Welcome back. Today, I want to talk about one of the most confusing and honestly discouraging moments in SIBO recovery. You finally start doing something to address what's been going on, and instead of feeling better, you feel worse. Not just a little worse, more bloating, more distension, fatigue that drags you down, brain fog, and that weird flu-like feeling where you really just start to feel like you're coming down with something. And it really throws you off because you're expecting to start feeling better. So your mind immediately goes to, okay, this isn't working. My body isn't reacting well to this agent, whatever it is I'm taking, or maybe this just is not going to work for me. And I can't tell you how many times I've had someone come to me at exactly this point, either about to quit or already have quit and convinced that they just can't tolerate the treatment that they need to feel better. But in most of these cases, what's actually happening is not a bad reaction. It's something called die-off, which is also known as a Herxheimer reaction. In today's episode, I'm going to walk you through exactly what's happening in that moment because in most cases, it's not that you're not reacting well to the agent. So, understanding how to recognize it and move through it the right way makes all the difference between quitting and giving up on a treatment and actually getting the results that you deserve. So let's start by defining what is die-off. When you start addressing SIBO, whether it's from antibiotics, prescription antibiotics, herbal antimicrobials, or the elemental diet, regardless of what you're using, you're killing off bacteria that have overgrown in the small intestine. And as these microbes die, they release compounds like endotoxins, including something called lipopolysaccharides or LPS. These are components of certain bacteria. It's actually part of the cell wall, and they activate the immune system when these bacteria die off. And then your body has to process and clear these toxins. If your body can't keep up with clearing those byproducts as quickly as they're being released, they temporarily build up and circulate throughout the body. So, a simple way to think about it is if you're cleaning out your room and you're taking out the trash, if you just put one trash bag out by the curb, no problem. But if you suddenly dump 10 bags at once and they're just sitting there and building up over time, that starts to feel pretty overwhelming pretty quickly when they build up quicker than they can be cleared. So that buildup is in your body is what creates symptoms, and your body is trying to process and clear a large amount all at once. And sometimes it just can't keep up with the pace. And why does this happen so often with SIBO? This is where SIBO is very different from something like a sinus infection. If you take an antibiotic for a sinus infection, you're going to feel a little bit off anyway, but you're usually not dealing with a significant die-off reaction. And part of that is because it's a relatively small localized area. With SIBO, it's completely different. Your small intestine is about 20 feet long. And when you factor in the surface area, it's actually massive because intestine is actually lined with tiny finger-like projections called villi that are designed to maximize surface area and therefore absorption. So when we're talking about bacterial overgrowth in the small intestine, we're talking about a tremendous volume of microbes being addressed all at once. So when you start addressing it, you're not killing off a small pocket of bacteria in your sinus. You're talking about a much larger burden all at once. And on top of that, the byproducts released in the gut can be reabsorbed and circulate throughout the body, which is why symptoms don't just stay in the digestive tract. You can feel them systemically. And this can be even more pronounced if one of the common mistakes is happening, which is trying to address SIBO while you're still constipated. A lot of people with methane SIBO will do this. If your bowels are not moving regularly, those byproducts have more opportunity to just be reabsorbed and recirculate throughout your body. So this is why die-off is something we see so often during SIBO work. It's not at all unusual. In fact, I would say the exception to the rule is if somebody has no die-off, honestly. And it's just a reflection of just how much bacteria or microorganisms, archaea, in the case of methane SIBO, are being addressed at one time. So, what does die off feel like? Most people tend to experience this in one of two ways, and sometimes it's a mix of both happening at the same time. The first is temporary worsening of your usual digestive symptoms. So, whatever you're already dealing with, whether it's bloating, distension, it's going to feel more pronounced. If constipation is part of the picture, it might get worse. So, stool might be more difficult to pass. It basically feels like your baseline symptoms are getting turned up. The second is more systemic. You may feel fatigued, have headaches, notice more brain fog, feel more irritable or just low, or just have that general sense of it's almost like you get that feeling of immune activation in your head, like when you feel like you're starting to come down with the flu or a cold. And for a lot of people, it's not just digestive or just systemic. A lot of people experience both types of symptoms. So you might be more bloated and uncomfortable in your gut while you're also feeling run down, foggy, or just general malaise, just not feeling good, feeling yucky. It can feel incredibly intense, actually, if you're not expecting it. I mean, we are not talking about a subtle thing. So that's why a lot of people assume that they're actually having a negative reaction to the medication or to the supplement, or that something is going wrong or not working. I actually had a patient early on in my practice. This was before I really understood much about this. I didn't understand how important it is to ramp up the dosing. I started her on the full antimicrobial dose right away instead of building her up gradually. This is something I've only done once. I don't ever do this anymore. So I started her on the full dose, and within a few days, her symptoms escalated so much that she ended up going to the emergency room because the pain and discomfort in her abdomen felt so severe. She thought something was seriously wrong. And that's obviously not what we want. And it's also not how this is supposed to feel when it's being done correctly. In most cases, when this is managed well, it's temporary, it tends to be more front loaded, and we keep it mild. But it's not how you're expected to feel the entire duration of the protocol. It's toward the beginning that it happens. So, let's talk a little bit more about what to expect when it comes to timing and intensity of die-off, because one of the things that can really make this confusing is that not all die-off follows the same timeline. With bacterial die-off, which is technically what we're dealing with SIBO, there's usually an earlier pattern. In a lot of cases, symptoms will start to show up around day 2, and they'll peak over the next few days and settle back down around day 5. Tends to come on more quickly and then be relatively short-lived. And one important thing to understand is that this pattern can repeat with each dosage increase as you ramp up from a lower dose. So as you increase over time, you may notice that same wave of symptoms come back starting again around day 2 and calming back down around day 5 with each increase. We'll talk more about how to handle that in a minute, but this is a normal part of the process. Now, with yeast-related die-off, it's often more delayed and more prolonged. Things may feel completely fine at first, especially if you're ramping up your dose gradually, and then all of a sudden symptoms hit later. I tend to see this happen almost exactly at the 2-week mark. So it's a little challenging because if we're only expecting bacterial die-off and we're going ahead and ramping up the dose, we don't even know die-off is going to hit until the 2-week mark. And then sometimes it's more severe than we would like it to be. If you do suspect yeast, I would recommend ramping up more slowly. And then when the yeast die off hits, it tends to last for several weeks. So it ends up feeling much more drawn out compared to the shorter bacterial pattern. Part of what's going on with this is that yeast, which we refer to as candida sometimes it's also referred to as SIFO, which is SIFO. It stands for small intestinal fungal overgrowth. Yeast can be present alongside bacterial overgrowth, especially in methane or mixed cases. We're just not always testing for it directly. The SIBO breath test is only testing for bacterial or archaea overgrowth. It's not testing for yeast. So we know that it's often there. We just don't have a perfect test for it anyway, honestly, but many of the herbal antimicrobials that we use will impact both bacteria and yeast. So we see it come up with the herbals because herbals are crossing over and killing bacteria and yeast. So we're seeing that yeast die off compared to prescription antibiotics. They are only going to target the bacteria. Honestly, in practice, I tend to see less die off with the prescription, which in a sense is a good thing. It feels like the prescriptions are being tolerated better. On the other hand, then the yeast that's silently there is not being addressed. There's a con there. But the timing and pattern of these die-off symptoms, especially when you look at your full clinical picture, what are the symptoms that you're really having, and do they correlate with yeast? That can give us really helpful clues that yeast is part of what's going on. There have definitely been patients that I've worked with where that kind of confirmed for me that yeast was part of the picture because they had some of the symptoms that were pointing to yeast, maybe frequent yeast infections, maybe histamine intolerance, which we see commonly correlate with yeast. And then that die off didn't kick in until 2 weeks. And then it was prolonged. So that's what that picture looks like. Now, whether this is coming from bacterial die off or yeast, the takeaway is the same. And this is where a lot of people get thrown off because they think, man, I was doing okay. Why am I suddenly feeling worse now? And at that point, it's not about pushing through, it's about adjusting. And this is also where that common belief of, okay, it's supposed to get worse before it gets better can actually get people into trouble, or the mindset of, I just need to power through this. I don't advocate for that at all. Die off should be manageable, it should not be overwhelming or out of control. If symptoms are becoming intense, that's not something to ignore and it's not something to push through. That's your body telling you it is not able to keep up with processing what's being broken down at that pace. And that's really the core concept here. The severity of symptoms is not a test of willpower. It's a reflection of your body's ability to process and clear what's being addressed. I've also had patients try to go the opposite direction and just push through it. I remember one client, she was a very high functioning woman. She was a lawyer. She told me, I've been through law school, I've run a marathon, I can do hard things. I just want to get this over with as quickly as possible. I want to knock out that her, she had methane SIBO, knock it out. So against my strong advice to ramp up her dosage of her antimicrobials slowly, she started at the full dose. She made it 3 days. By that point, the symptoms were so intense that she basically said, okay, mercy. So we had to stop for a few days, let everything settle down, and then start again at the low dose and build up gradually, as I do with absolutely everybody now. And that's really the point here. You can have all the willpower in the world, but this is not something you want to push through. And very often the symptoms can become too intense, which is why we don't start at the full dose. We build it up at a pace your body can keep up with and that you can keep up with because you have to be able to function, right? Our patients function through the die off process. We don't let it knock them down. So this part really will make or break your progress with SIBO. If you can't get through die-off, you can't clear the SIBO. What I see all the time is people starting to address SIBO, hitting the die-off phase, and either stopping too early or never being able to work up to a full therapeutic dose of antimicrobials. But the reality is we need to get to that full dose and we need to stay there long enough to actually do the job. In many cases, that also means going through more than one round, not just one round. Most people with SIBO need more than one round. 2 to 3 rounds is what we see most often. So if someone can't get through that initial phase, they never really get to the part where things start to improve in a meaningful way. And this is a big reason people stay stuck with SIBO. They've tried things before, started something, maybe antibiotics like rifaximin, got a few days in, started to feel worse and had to stop. And then they tell me, I didn't tolerate the rifaximin. I hear this all the time. I made it a few days, but I just couldn't continue. And in most cases, they were started right at the full dose. In fact, in conventional care, dosing is typically started at the full therapeutic level. You rarely see it ramped up, if ever. And that can make die-off feel more intense and harder to tolerate. That's actually one of the reasons often prefer using herbals in many cases, because we have the ability to start at a lower dose and build up gradually in a way your body can tolerate, because this really can make or break your progress. And if you can't get through that phase, you can't get to the full dose, you can't complete the course, you're not going to be able to clear the SIBO. And this is one of the biggest things that keep people stuck. It's so easy to go through that experience and think, I guess I just don't tolerate this. But in the vast majority of cases, that's not actually what's happening. All right, so what we need to do now, if I've scared you at this point, please don't be scared, because every day, every week in our practice, we help people clear SIBO and get through die-off in a way that is very tolerable. So what we need to do is slow things down and actually look at what happened. Most of the time, it's not that the person couldn't tolerate it, it's that the process wasn't managed in a way their body could handle. So when we go back in and do it differently, and that means priming the system, getting motility going if someone is constipated or not fully evacuating, calming symptoms down to a more stable baseline, starting at a lower dose, adding the right supports to help bind and clear what's being broken down, and pacing it appropriately, they're able to move through with minimal issues. And that's usually a huge shift for people, because it changes the story from my body can't handle this to this just wasn't approached the right way. So let's talk about what die-off should feel like. The goal here is not to push through extreme symptoms. Die-off should feel mild and manageable. You should be able to function, go to work, and live your life. It might feel noticeable, but it should not feel overwhelming or out of control. If it does, that's a sign we need to adjust, not push harder. A big part of how we keep it in that range comes down to how we approach it from the beginning. What this looks like in practice is, first of all, priming the system. And the biggest thing I see with this is if the person starts out super reactive already, if your baseline symptoms are off the charts, for example, if you're super constipated, or if you're just reacting to everything you eat, bloating with everything you eat, then even a mild increase in die-off symptoms is going to be too much for you. So the very first step is decreasing your baseline of symptoms. And we do that through strategic diet changes, maybe therapeutic diets, and through getting motility going. However we need to do it. We'll talk about that a little bit more in a second. Then, once we're ready, and we've lowered your baseline of symptoms, we start you at a lower dose. So we do not jump into the full therapeutic dose, and then we pay attention to how your body responds. From there, you're watching to see what your pattern shows up like. So for some people, symptoms might start around day 2 and settle around day 5, but for others, it might be shorter. I've definitely had people have symptoms just on day 2 and calming down by day 3. It might be a little longer, maybe up to a week, depending on what's going on. The key is that whatever shows up should stay manageable. And then here's the key. You only increase from there once symptoms have settled back down to your baseline, whether it takes a few days, a week, or longer. That's how you move through this without spiraling, because what will happen is each time you increase, you may feel that same wave of symptoms again. But if you're doing this correctly, it stays mild each time. You're not repeatedly putting your body into an overwhelming state. This is also why we don't jump straight into the antimicrobials, that first step. So again, this is worth repeating. If your baseline symptoms are already high, you're bloated, you're constipated, you're uncomfortable, then even a small increase can feel way too overwhelming. So get your baseline stable first so your body's in a better place to handle what comes next. That's definitely our first step when we approach this, and it is not something to skip over. So that might look like getting your bowels moving more regularly, adjusting the diet so you're not constantly triggering symptoms with fermentable foods, for example, and bringing overall symptom intensity down before introducing antimicrobials. So when we take time to stabilize that baseline first, it makes the entire process much more tolerable and much more successful. And when this is done well, the whole process is much more manageable. The way it ends up looking is, let's say you go on a hike where there's a really steep hill right at the beginning, but once you get to the top, the rest is a beautiful gradual decline. Sounds like my perfect kind of hike, honestly. That's how die-off is. The first 10 minutes of the hike might feel intense in this analogy and take more effort, but then the next 40 minutes are smooth sailing. You're just coasting down the hill. So with die-off, that's how it is. You have these symptoms happening in the very beginning, but once you get to that last dosage increase and that final little crest of symptoms, then you're just looking at the rest of your course, and even the subsequent courses are smooth sailing. From there, you just see weeks, or if you're on treatment for a couple months, you just see gradual improvement from that point. I just want to be clear that die-off is not something that happens typically throughout the entire course of the antimicrobials. It's just at the beginning. Now, let's talk about what signs to look for. When might it not actually be die-off? So that is one really important distinction to make here, is that although for the most part, it usually is die-off, there are times when maybe you're just not tolerating the treatment. Maybe you're having a bad reaction or a side effect to a treatment. One way to determine this is to look at the pattern. Die-off tends to follow a pattern. It shows up within a few days, or in the case of yeast, a couple weeks of increasing your dose. It builds for a short window and then it settles back down. And then even if it repeats with dosage increases, there's still that sense of a rise and then a return toward baseline. So when I'm looking at this clinically, I'm not just asking, do you feel worse? I'm asking how it showed up and what it's doing over time. If symptoms are continuing to escalate without ever leveling off, that's usually not die off. If someone says, I just keep getting worse every day, or it has not let up at all, that's a totally different pattern. Same thing if new symptoms show up that don't really fit the symptoms we talked about, something that feels really off from what we would expect with die off, or if we've tried adjusting the dose, maybe back down, slowed things down, and nothing improves. So at that point, I'm thinking less about die off and more about whether this is something your body just is not tolerating well, and maybe we need to switch agents. So the patterns matter. The patterns are what tell us whether to stay the course, slow things down, or pivot entirely. Now let's talk about some troubleshooting strategies. And basically, honestly, since we anticipate die off in most cases, we incorporate these strategies with our patients. These are the things that we do to minimize die-off. There's a few key things that really make a difference here. And honestly, it's the difference between somebody moving through this relatively smoothly versus feeling like they can't tolerate it at all. The biggest one by far is bowel function. Again, if someone is constipated, which we see all the time with the methane or mixed type, or even if you're just not fully evacuating, because constipated is a confusing word. People aren't quite sure what it means. You could be having a bowel movement every day, but if it's small, if it feels incomplete, if you aren't fully evacuating, we do not move forward yet. Now, when you add the antimicrobials, you're breaking things down faster than your body can clear them. And those byproducts just sit in the gut. They get reabsorbed, they recirculate, and the symptoms can ramp up really quickly and feel more intense than they need to. I see this all the time. People have tried different things for constipation. They feel like nothing has really worked, or they don't want to rely on something long term. So they just end up not supporting their bowel movements, staying constipated, because a lot of people are used to feeling that way. I hear people all the time tell me, yeah, maybe one or two bowel movements a week. I've been that way a long time. It bothers them, but they're used to it. And maybe they just don't want to take the Miralax. It's like, I don't want this to be my solution. And I totally get that. We are all about addressing root causes like methane SIBO, so you don't need to rely on your laxative long term. But this is the time to actually get your bowels moving regularly and fully. This is the time to use the tools. So I get it, but right now we need to bring those agents back in, whether it's a motility medication, whether it's magnesium in a form like magnesium oxide or citrate, building that dose up to what's actually effective. Because magnesium dosing that is effective to move your bowels is often much higher than the label dose. Or using something like an osmotic laxative, such as Miralax, which pulls water into the stool as well and helps things move. There's a lot of agents I could list off. There's things like Triphala. People sometimes will use Sena. So whatever medications you've been prescribed, whatever it is, suppositories, enemas. The point is, now's the time to get things moving. This is the time to do it because this is critical to your success getting through die-off. Now, the next piece is getting your baseline symptoms down before you start. So if you're already bloated, uncomfortable, reacting to everything, you're not going to want even a small increase in your symptoms. So we want to calm that down first. And that can look like adjusting your diet to reduce fermentation, pulling back on foods that trigger you, using symptom relief strategies so you're in a more stable place. That's a huge part of what we do at Nutrition Resolution. We don't just jump in, we set the stage so the process is actually tolerable. From there, how you start matters just as much. A lot of people, when I first enroll them in our program, they'll say, oh, should I wait to have the first session till I get my SIBO results back? And I say, no, we need to spend the first session priming your system, getting all these things done. We have a lot of work to do to prime your system. And then by our second consult with you, we'll have the SIBO results back and we'll be able to start those antimicrobials at a low dose if we do this work in advance. So once we are ready for that phase, we start low. For some people, it's very low. Sometimes, if you're more sensitive, if you have yeast, if you have histamine intolerance, those people are very sensitive to things. Sometimes we're just starting with as little as one capsule of whatever the product is, because with antimicrobials, typically the therapeutic dose is much higher than one capsule. So we might just start with the one capsule. From there, you gradually build up based on how your body responds. And the goal is to create a mild, manageable response. Not nothing. It's not going to feel like nothing happened. Typically, it can. Don't get me wrong, there are people that get their die off with flying colors. They don't notice anything. That's just a testament to your body's ability to detoxify quickly. But most people will feel something, but it shouldn't be something that takes you out. And then you just wait for that to settle back to baseline before increasing again. And honestly, when it's manageable like that, a lot of people don't mind it as long as they know what it is. Once you know this is not something that's hurting me, this is not something that's going wrong, it's just a mild worsening in symptoms that's part of the process, people are like, okay, I can do that as long as I can still function, as long as I feel okay. The other piece that can make a big difference is supporting your body in clearing what's being broken down. One of the ways we do that is binders. Binders are supplements that essentially bind to and help carry some of the byproducts that are being released, like that LPS or endotoxins. It carries them out of the body, so they're less likely to be reabsorbed and trigger symptoms. You'll often see things like charcoal or bentonite clay used for this, among others. And when used appropriately, they can be really helpful. They basically act like sponges. They soak up those toxins and then you eliminate them in your stool before they can recirculate into the body or affect or even activate your immune system. And then we're also looking at supporting the body more broadly, and that might include things to calm inflammation. So it could be getting a little extra vitamin C. It could be over-the-counter anti-inflammatory medications for a short period of time, just to manage those symptoms. Hydration is a huge piece of this because you need enough fluid coming in to actually flush these toxins out. So this is one of those times where you want to be drinking more water than you even think you need. And some people also do well with things like Epsom salt baths. Again, it helps your body detoxify. I would just advise against this if you have hydrogen sulfide because there's a sulfur component to Epsom salt. So in that case, it can actually ramp up symptoms. But for hydrogen or methane types, or even yeast, it can be helpful to do Epsom salt baths during this process. We also may want to support bile flow for certain individuals because bile is another pathway the body uses to clear toxins. So to do that, we might incorporate bitter foods or bitter herbs to help stimulate that. We might focus on gentle movement, exercise, plenty of fluids. And then just as important as everything we've talked about is knowing when to adjust. If symptoms are becoming too intense, lingering without relief, or interfering with your ability to function, that is not a sign to push harder. That's a signal. It means your body needs more support, more time, and a slower pace. So you adjust, you pull back, you let things settle, and then continue in a way that your body can actually handle. Because the goal here is not to see how much you can tolerate. The goal is to move through the process in a way that actually allows you to see it through and finish the job. So adjust when needed. And this is just as important as everything we've talked about, knowing when to adjust. You'll often hear the advice to just decrease the dose if symptoms are too intense. And that can sometimes be helpful, but I'm going to be honest. In my experience working with so many patients on this, if symptoms are intense enough that you're feeling miserable, the quickest way to feel better is to simply just stop. Stop the antimicrobials just for a day or two. If you only slightly reduce the dose, the symptoms can end up just lingering and being uncomfortable. Whereas if you take a short break, let your body catch up with clearing what's already been broken down and actually allow the symptoms to settle, you're going to feel better way faster. Then you go back in at that step down. So then when you start them up again, now you're stepping down the dosage a little bit from what made you feel miserable. And you're really not losing much time by doing this. Honestly, a day or two is nothing. You're not starting all over. You're just stepping back slightly from the dose that was too high and then continuing from there. So don't worry about that setting you back. In most cases, it actually helps you move forward more efficiently. And here we are toward the end. I want you guys to know that if you're going through this right now, or you've tried before and felt like you just couldn't get through it, this does not mean that it's something your body can't handle. Most of the time, it just means it was not approached in a way your body could keep up with. When this is done correctly, when we stabilize your baseline, support your body's detoxification, pace things appropriately, hydrate, adjust when needed, it becomes so much more manageable. And that's when people actually start to see real lasting progress. And you don't have to do this alone. You deserve someone to help you. So if you'd like help figuring this out or just getting an idea of what this might look like for you, I'm happy to talk through it. So I'm going to link to the 15-minute strategy call in the show notes. And that's a call where we can talk through what's going on, see if our work might be a good fit for you. And if it is, we can talk about what a more personalized approach would look like. All right, guys, thanks so much for joining. I really hope this was helpful and looking forward to coming back next week.